Former Bachelorette Katie Thurston reveals she's been diagnosed with breast cancer in an emotional post on Instagram, saying she's ready to fight and hopes sharing her story with others will help. Breast cancer is the most common cancer in women, with 1 in 8 women diagnosed in their lifetimes. Here for this week's Weekend Wellness is Dr. Nicole Saphier. Dr. Nicole, great to see you. We're seeing breast cancer rates increase with younger women. Why?
That's right, Lisa. Good morning. Breast cancer in young women is on the increase. About 10% of all breast cancers diagnosed right now are in women under the age of 45. And it's from a combination of factors, from genetic, lifestyle, and environmental. And the most common risk factors that can increase your risk or considered high risk are having genetic mutations like BRCA1 and 2. We've seen this widely covered by the media. There are also other risk factors. Family history of pancreatic cancers, prostate cancers, male breast cancer also increase your risk. Having radiation to your chest, if you had lymphoma, say as a teenager, can increase your risk. And also if you have certain breast biopsies that have pathologies that are what we call, excuse me, high-risk lesions, that can also increase your risk of breast cancer. Now, Lisa, one thing that concerns me is these younger women tend to get more aggressive breast cancers. And as you know, younger women are not necessarily getting screening mammograms because they're too young. And a lot of it has to do with our environment, the microplastics, the hormones, all of these things that we are consuming, and we have turned into a sedentary society. So ways that we can decrease our risk of breast cancer are by maintaining a healthy weight, getting to the gym, make sure we're moving our body, try to decrease the exogenous hormones that we are putting into our skin, whether it's from the meat or the eggs or the dairy that we're consuming. We want to make sure it's hormone free. And also, women are having babies later in life. Having babies later in life actually increases your risk for breast cancer. When you have babies earlier in life and when you breastfeed them, that can actually decrease your risk of breast cancer.
So doctor, I know that you have to deliver this tough news sometimes to women. If we know that rates are increasing, are we adapting the way that we surveil and that we test and we try to diagnose this? Or are we adapting our ways to the increase in rates?
So we certainly are evolving our technology to find breast cancers at the earliest stage possible, and we're trying to identify women early on, even at the age of 18, for those who may be considered high risk, so that we can start surveilling them earlier in life and using MRI and other technologies to find breast cancer at its earliest and easiest to treat stage. But when it comes to why we're having more cancers in young people, that is going to take a huge effort, and that is going to be removing a lot of the toxins from our environment so that we are not increasing our risk of breast cancer because of what we're being exposed to.
And I know you've been a big champion of making America healthy again. You're one of the first out there with your book. So we appreciate what you do. You're so smart and a friend. Thank you to Dr. Nicole Saphier. Great to see you this Sunday.